We don't know yet what the impact of the drug price negotiation program will be on patient access to selected drugs. Our research explored what access to those drugs looked like before MFPs went into effect. What we found was that coverage and access were high in 2019 and increasing through 2023, including few utilization management barriers for most of the drugs. Now, once those MFPs go into effect, plans will be required to cover them, but CMS has not instituted other guardrails around formulary tiering or utilization management. And there are changing incentives for plans that may be incentivized not to cover the selected drugs as generously if they have less flexibility for rebates than their non-selected alternatives. And all of this is happening amidst a backdrop of changing premiums, formularies, and reduced plan options for patients. We don't know yet what 2026 formularies will look like. Some of the things that we do know. NPC research benchmarked access to the selected drugs, finding that access was generally high in 2019 and increasing through 2023, with few utilization management barriers for most of the selected drugs. An IQVIA analysis found that 6 of the 10 drugs are generally covered with a copayment, which does not depend on the price of the drugs, suggesting that patients won't see decreases in those copayments if the prices of the drugs change, and they may see increases if copayments increase across the board. Now, changes are happening amidst these other incentives for plans to increase utilization management because of the Medicare Part D redesign. CMS has already had to step in with a demonstration project, giving insurers $10 billion to stabilize premiums. And there are already concerning signs in the 2025 formulary coverage that may inform what we're likely to see in 2026. So preliminary NPC research saw an 11.4 percentage point decrease in the proportion of beneficiaries with covered access to drugs in competitive classes. That drop was seen just in 1 year alone from 2024 to 2025. So we are certainly going to be keeping an eye on how patient access is changing amidst this changing landscape.